This is a very important video. In this video, I won't be talking about any gastric pathology, nothing about gastritis, nothing about peptic ulcer disease. But all the concepts within this video are very much necessary for you to understand those topics. If you get the hang of the topics taught in this video, I assure you, learning pathogenesis of gastritis and peptic ulcer disease will be a cakewalk. So I want you right now to put your attention in this video, because if you understand this video, the coming videos are going to be much easier. With that being said, what are we going to talk about in this video is about the condition of the wall of your stomach. See, the wall of your stomach is under continuous stress. However, this stress is overcome by protective factors present within the stomach. See, the wall of your stomach is made up of four major layers. There's your mucosa, submucosa, muscularis propria, and serosa. Mucosa contains three further layers. There's epithelial mucosa, lamina propria, and muscularis mucosa. The epithelial mucosa is composed of simple columnar epithelium. The simple columnar epithelium contains mucus secreting cells as well. Mucus secreting cells and enzyme secreting cells. Mucus secreting cells plus enzyme secreting cells. Okay, that's basic histology that you most probably know. Now, what I'm talking about is the condition of the wall of the stomach along with all these four layers: mucosa, submucosa, muscularis propria, and adventitia. The condition of these layers within the stomach wall. The condition of these layers within the stomach wall, or shall I say, the condition of the stomach wall itself, is determined by two factors. They are your damaging factors and protective factors. Very easy. Damaging factors are the factors that are continuously trying to damage your stomach. Protective factors are those factors that are continuously protecting the wall of the stomach from damaging factors. All right? Simple thing. Damaging factors trying to damage the wall of the stomach. Protective factors protecting the wall of the stomach from being damaged. Now, simple logic. If damaging factor is more, or let's say protecting factor is less, what is going to happen? The wall of the stomach is going to get damaged. So before understanding about the damage or the injury, you need to understand about what is happening normally in your stomach. Normally, in your stomach, there are factors that are continuously trying to damage the wall of the stomach. And then there are factors that are continuously preventing this damage from occurring. So what are these factors? First, the damaging factors. Within the lumen of the stomach, there are two major things. Number one, hydrochloric acid, and number two, peptic enzymes. Hydrochloric acid, it has a very low pH of around 1 to 2. So it is highly corrosive. It can easily damage the wall of the stomach. Peptic enzymes, on the other hand, it has the ability to digest protein. Is the wall of the stomach made up of protein? Obviously, it contains protein. So it can digest the wall of the stomach as well. Acid with very low pH, highly corrosive. Peptic enzyme can digest protein and subsequently can digest the wall of the stomach. That will eventually lead to what? Perforations in the stomach. But normally, let's take scenario of my stomach, which is normal right now. I don't have any gastritis. I don't have peptic ulcer disease. So normally talking, are there perforations in my stomach? Is the wall of my stomach ruptured? I mean, if it was, I wouldn't be here right now. I would be dead. But anyway, I'm not dead. That's because my stomach is normal. But this doesn't mean inside my stomach there is no acid or peptic enzyme. There is acid and peptic enzyme. There are damaging factors. But working against these damaging factors are the protective factors. Right? So these are the protective factors present from inside to outside. This green layer that you see right here is nothing but mucus. Mucus is secreted by the surface epithelial cells, also known as the foveolar cells, lining the wall of the stomach. So the foveolar cells or the surface epithelial cells lining the wall of the stomach produces mucus. And this thick layer of mucus, what does it do? Within the lumen, there is HCl, there is HCl, there is HCl, there is HCl. This HCl will not touch the wall of the stomach because there is a physical barrier in between HCl and the wall of the stomach. And that physical barrier is this thick green layer right here, and that is mucus. Next, bicarbonate. The same foveolar cells, they also produce bicarbonate. The bicarbonate is also present along with mucus right here. Bicarbonate. The function of which is, so the acid present near the wall of the stomach will get neutralized by the bicarbonate. Neutralized by the bicarbonate. So basically they are no longer corrosive. Next, let's say somehow the H plus from the lumen of the stomach passes through the mucus and the bicarbonate and reaches the epithelium. It is unable to enter inside or leak inside. Why? Because in between epithelial cells, in between these epithelial cells, there is presence of tight junction. So tight junction prevents the leakage of H plus ions inside lamina propria. Inside lamina propria. Fourth, epithelial regeneration. The good thing about the epithelium lining stomach is that even if it does get destroyed or maybe it gets old, the thing is they get regenerated really fast. So there is new epithelium forming very quickly. Next, mucosal blood flow. Now, good supply of blood to mucosa means good supply of oxygen and nutrients to mucosa. That means the repair of epithelium can take place very quickly. Lastly, prostaglandin. So specific prostaglandin like prostaglandin E2 has many functions, or shall I say it is involved in almost all of these functions. Like it is responsible for increasing mucus, thickening mucus. It is responsible for epithelial regeneration. It is responsible for increasing mucosal blood flow as well. When there is more blood flow, there is easy repair. But most importantly, it inhibits the secretion of HCl within stomach. Within stomach, what takes place? The secretion of HCl takes place. The secretion of this HCl is inhibited by prostaglandin E2. So when there is less HCl, that means there is less damaging factor. Normally, there's lots of protective factors. They easily overwhelm or overcome the damaging factor. That is why normally your stomach is all right. It's fine. Now let's talk about injury. Injury. In injury, see, either there is an increase in damaging factors or there's a decrease or impairment of protective factors. Damaging factor can be more. It will damage the wall of the stomach. Or protective factors can be impaired, so it can't protect the wall of the stomach, eventually leading to damage of the wall of the stomach. What can lead to increasing damaging factors? They are NSAIDs. So non-steroidal anti-inflammatory drugs. They are COX inhibitor or cyclooxygenase inhibitor. As a result, there will be no COX pathway, and COX pathway is responsible for formation of prostaglandin. So there will be no prostaglandin. If there will be no prostaglandin, there will be increase in level of HCl. Why? Because HCl is inhibited by prostaglandin. But if there is no prostaglandin, there is no inhibition of HCl. That means there will be increase in HCl. Good. Next, Helicobacter pylori. Helicobacter pylori infection. So Helicobacter pylori is urease positive. It can produce urease. Urease will break urea into ammonia. And when there is increased amount of ammonia, what happens? This ammonia, it inhibits bicarbonate transporter. So there is no longer bicarbonate in the mucus lining. Plus, Helicobacter pylori is also responsible for hypersecretion of acid. So it increases the secretion of acid as well, further damaging the wall of the stomach. Another, alcohol, tobacco, radiation, chemotherapy, they have direct damage. That is, they directly go and damage the cells lining the wall of the stomach. Then duodenal gastric reflux. Basically, the content from within the duodenum will reflux or regurgitate back into the stomach, return back into the stomach. And what is present in duodenum? Only two things: bile from liver and pancreatic juices from pancreas. This alkaline fluid, it produces stress on the wall, damages the wall of stomach. That is increase in damaging factors. So NSAIDs increased damaging factor by increasing HCl. Helicobacter pylori increased damaging factor by inhibiting bicarbonate transporter and increasing HCl. Alcohol, tobacco, radiation, chemotherapy increased damaging factor by directly damaging the epithelial lining. Duodenal gastric reflux increased damaging factor by increasing alkaline fluid to putting stress on the wall of the stomach. Now, how can decrease in protective factors take place? Ischemia. When there is ischemia, there is decrease in mucosal blood flow. That means there is decrease in oxygen and nutrients. That means injury takes place, necrosis of cells take place. Second, shock. Shock eventually leads to ischemia. NSAID. NSAID, it inhibits COX pathway, it inhibits prostaglandin. Prostaglandin is not just responsible for inhibiting the secretion of HCl, it is also responsible for increasing the secretion of mucus and bicarbonate, that is protecting the wall of the stomach. But since prostaglandin is inhibited, there is decrease in mucus, there is decrease in bicarbonate. This is how there is decrease in protective factor. With ischemia, there is decrease in mucosal blood flow, decrease in protective factor. With shock also, there is decrease in mucosal blood flow, decrease in protective factor. NSAID also leads to decrease in mucus and bicarbonate, decrease in protective factor. So be it an increase in damaging factor, that is increase in HCl or decrease in bicarbonate, or be it decrease in protective factor, eventually what happens is that the damaging factor will overcome the protective factor, and this leads to injury. Now, normally the damaging factor is balanced or overcome by, the wrong side, is overcome by the protective factors. Protective factors overwhelm the damaging factors. But in case of injury, there is either an increase in damaging factors which lead to destruction of wall of stomach, or a decrease in protective factor which leads to damage in wall of stomach. Be it an increase in damaging factor or decrease in protective factor, overall damaging factor becomes more than protective factor. And when there is injury, pathologies occur. There are two types of pathology. If there is damage of the wall of stomach without inflammation, that is gastropathy. But if there is damage to wall of stomach with inflammation, that is gastritis. All right, gastritis, if it is for a short period of time, acute gastritis; for a long period of time, chronic gastritis. And gastritis, it can worsen and eventually lead to formation of ulcers. And ulcers, that means there is peptic ulcer disease. What are the signs and symptoms? See, since there is damage in the wall of the stomach, obviously pain is gonna occur in the area where the stomach is present. So epigastric pain with nausea and vomiting. As for signs, mucosal erosion. Mucosal erosion is where part of the mucosa gets ripped off or slowed off. Ulceration. Ulceration is much more deeper. It involves mucosa as well as submucosa. So two terms, mucosal erosion and ulceration. You need to know the difference. First, mucosal erosion, where the mucosa gets ripped off, right? Ulceration, where mucosa is affected plus submucosa is also affected. Hemorrhage, obviously, since parts are getting slowed off, ripped up, damaged, blood vessels are gonna burst and blood is gonna come out. That is hemorrhage. So within stomach, now there is blood. This blood has two ways to come out, either from here or from here. So if it comes from up here, from the mouth, it can come along with vomitus, and this is called hematemesis. Emesis means vomiting. Hemat means blood. So there is presence of blood in vomit. Second is melena, that is blood in stool. Due to the presence of hemoglobin in stool, the stool becomes dark black in color. Those are the signs and symptoms. All right, one last revision. So there are two factors that determine the condition of the wall of your stomach. Damaging factors, continuously trying to destroy or damage your stomach wall, and protective factors, continuously working to protect the wall of the stomach from damaging factors. Normally, damaging factors include acid and peptic enzymes. So acid within the stomach is trying to burn the wall of the stomach. Peptic enzyme in the stomach is trying to digest the wall of the stomach. But is your stomach digested? Is your stomach burnt? No, it is not. Because of the presence of protective factors working against it. And they are the mucus lining the wall of the stomach that forms a physical barrier between HCl and the wall of the stomach. Bicarbonate within the mucus, which neutralizes the acid near the wall of the stomach. Tight junction in between the epithelial cells of epithelium, right, which prevents the leakage of acid within the wall of the stomach. Epithelial regeneration, as a result, new epithelium gets formed pretty quickly. Mucosal blood flow that provides enough oxygen and nutrients for repair to take place. Prostaglandin, like prostaglandin E2, which inhibits the secretion of HCl and regulates HCl secretion, plus increases mucus secretion and bicarbonate secretion. So all these protective factors, normally they overcome the damaging factors, and that's a good thing. Your stomach is healthy and fine. But when there is injury can take place either due to increase in damaging factors or impairment in protective factors. Increase in damaging factors can take place how? For example, intake of NSAIDs that lead to inhibition of COX pathway. As a result, there is decrease in prostaglandin. As a result, there is increased secretion of HCl, because HCl is inhibited by prostaglandin E2, but there is no longer prostaglandin E2. That means there is going to be much more HCl in the stomach. Second, H. pylori infection. It is urease producing bacteria that converts urea to ammonia, and ammonia, it inhibits bicarbonate transporter. As a result, there is no bicarbonate. Decrease in protective factor plus increase in damaging factor, because H. pylori also increases HCl. Then alcohol, tobacco, radiation, chemotherapy, they have direct damage. They directly go and destroy the wall of the stomach. Then duodenal gastric reflux, content from within the duodenum regurgitates or comes back in the stomach. What is in the duodenum? Bile is in the duodenum. Pancreatic juice is in the duodenum. Alkaline fluid, it damages the wall of the stomach. Then decrease in protective factors like ischemia. If there is ischemia, that means there is no mucosal blood flow. That means there is no oxygen and nutrient. That means more injury takes place. That means necrosis of the cell takes place. Damage of the wall takes place. Then shock eventually leads to ischemia and everything that I just mentioned. And then NSAIDs, COX inhibitor, prostaglandin inhibitor. That means there is decrease in mucus, decrease in bicarbonate, because prostaglandin doesn't just inhibit HCl secretion, it also increases mucus and bicarbonate. Since prostaglandin is getting inhibited, that means there is decrease in mucus, decrease in bicarbonate. Overall, be it due to increase in damaging factors or impairment in protective factors, the damaging factor wins. And I mean, that's not a good thing, why am I cheering up? But that leads to injury and the wall gets damaged. Now, this damage eventually leads to either gastropathy, where there is no inflammation, or gastritis, where there is inflammation. Gastritis can worsen and lead to formation of ulcers. This is called peptic ulcer disease. Yeah, we are done.